we have Priya Shastri and Alexa Yakubovich, who will speaking about the violence against women services evaluation.
Thank you.
Hello.
Hi, everyone.
Alexa?
Yes. So my name is Alexia Yakubovich, and I am a CHR postdoctoral research fellow at the Center for Urban Health Solutions at St. Mike's Hospital. And my program of research largely focuses on the social and structural determinants of intimate partner violence and program and policy evaluation. I'm going to hand it over to my co-lead, Priya, who will introduce herself and some of the background around how the pandemic has impacted violence against women's services in Toronto.
Thanks, Alexa. So hello, everyone. My name is Priya Shastri. I'm the community lead for the VAW project. For the last 10 years, I've worked in the VAW sector in different systems, including Nunavut for 5 and the UK for 3. My work has included frontline delivery, program management, and networks coordination. So presently, I am the networks coordinator for Women Act. Women Act is essentially a second-tier organization, and what that means is we don't deliver direct frontline services to women experiencing violence. We support and mobilize the VAW organizations which do through research, policy, education, and coordination. My current role coordinates 3 of the ministry-funded Toronto region VAW networks, which consists of about 39 VAW organizations in Toronto. During COVID, what was coming out through the networks was essentially that there were a lot of challenges, but they were working through it and were very resilient and continue to be very resilient. Some of the things expressed were that the VAW sector had existing challenges with evaluation, with frontline support, and already delivering services. And when COVID comes around, what ends up happening is those existing challenges are exacerbated. Not only are they exacerbated, new challenges are created through the issue, through social distancing. One of the biggest challenges is that for frontline workers, creating safety and building rapport with clients was greatly impacted and affected because they're now transitioning to supporting clients through the phone. Some of those women are still at home with their partners or their perpetrators. The community support places where women could drop in to access support were closed. So outreach looks very different. For shelter workers and for organizations running shelters, you're worried about the spread of COVID. Women are worried about going into shelters because of what was being pushed around social distancing. And I think that's still there to a certain degree. Then you're looking from organizational perspectives, there were issues around and continue to be issues around the mental health of staff and supporting staff, having the resources to be able to adapt in-person services during this time. So there is a range of challenges that that the sector has faced. But they've also, I think, over the last 6 months, there have also been a lot of successes. And one of the challenges for the sector is the resources to capture those successes, to evaluate those successes, to highlight the challenges and capture how the sector has been working through those challenges. During crisis, finding resources to do evaluation is extremely challenging. So when this project came along, I was speaking with the networks, and the networks were excited to be able to engage in data collection and to have the support to do that, because it's not something that we would necessarily during a crisis be able to do on our own. So I'm very happy to be the lead and excited about it. I think our networks are very excited. I think one of my co-chairs is actually on the call. Hi, Carla. So she's joined to just get a little more information on the other projects. One of the other exciting things I just wanted to highlight about this, about the Marco project as a whole, is that each of these projects seems to have some kind of overlap with each other and can support and inform each other. So from a systems perspective, that's also an amazing thing to be a part of. So thank you, and I'm just going to pass it over to Alexa now, so she's going to discuss a little bit more about the evaluation design for the VAW project, unless anybody has any questions for me.
Great, thanks so much, Priya. That was a really excellent introduction to some of the challenges that the sector is facing and also some of the successes. And really one of the themes that Priya has drawn up that we want to emphasize with this evaluation is basically bringing a spotlight to the voices in the sector, both from a staff, leadership, and survivor perspective. And that's so difficult to do during public health emergencies. And we see that in the literature, that there's little representation of how the VAW sector adapts in public health emergencies. So really this evaluation is a formative and process evaluation, which very much represents our understanding that services are being adapted on an ongoing basis and aren't in their final or finished or polished format. And so we want to work with organizations to really understand what are the challenges that they have been facing, how have they adapted services, what are the processes of service adaptation, and what are some of the potential impacts of those service adaptations on both frontline staff, on leadership, and on clients. So we aim to conduct 2 rounds of data collection. One will be interviews and focus groups with organizations' leadership, frontline staff, and clients to understand their experiences before and during the pandemic. And then another round of data collection where we aim to look at some of the themes that have come up in the qualitative data using online surveys to further explore those themes and have a deeper understanding of them. So we are currently recruiting organizations. We're also very open to anyone who's interested in participating on the evaluation team. So if you are interested, please do reach out. Kimia is our coordinator, so she is our contact point. And yeah, just to wrap up, our goal is to draw actionable recommendations for participating organizations in this evaluation, for the VAW sector, for funders, and for policymakers to strengthen the response to violence against women during this pandemic and any future public health emergencies.